What's going on, guys? Welcome to the channel. My name is Taylor Kuhlman. I'm a doctor of physical therapy and certified strength and conditioning specialist. In this video, you are going to learn how you can improve knee range of motion, reduce knee swelling, reduce knee pain, improve strength of the knee muscles. Whether you've had an acute knee injury, maybe you had a total knee replacement several years ago and have a stiff knee, or maybe you just recently had a knee surgery. So these exercises, again, are very easy. They're basic. They will help you improve range of motion and initiate the strengthening process. With all of that being said, if you did just have a recent surgery, be sure to consult with your orthopedic physician or a physical therapist. There are certain precautions and limitations that you want to follow after certain orthopedic procedures. So be sure to check with them before you start your exercise routine, just to make sure you're not going to compromise the surgical procedure. So we're going to get started. We're going to go laying on your back, right knee bent up, left leg straight. We're going to do a heel slide. So we're going to work on the knee bending. So just laying in this position, try to slide your left heel up to your butt, and then we'll go back down. And then we're going to come back up. Try to go just as far as you can go. If it starts to get stiff at a certain point, that's where I would stop. Hold it in that position for 2 to 3 seconds, then let it back out to full knee extension. Try to let it go all the way back down to the table when you're doing these heel slides, and then start from this position again. So here I would do 10 to 15 repetitions, again with that 2 to 3 second hold where it gets tight, and then back down. Try to go just a little bit further each time. If you want to keep your foot flat, that's okay. Or you can pull your toes up and try to bend it. Pulling your toes up and bending your knee, you're going to be limited a little bit more. So if you have your foot straight, foot flat on the floor, and you slide your heel back, when you stop at the point where it's tight, you can get just a little bit more of a stretch by lifting your toes up. So you can see how I'm doing that here. So if I had a limited knee bending, I would pull my heel back, get it to where it's pretty tight but comfortable, hold for a couple seconds, and then I would do just little oscillations here by lifting my toes up. I would lift up, get a good stretch on it, back down, and I might do 5 to 10 of those. And then I would let it back down and repeat again 10 to 15 repetitions. After the heel slides, I would recommend doing an ankle prop. We're going to try to go the opposite direction. So get a towel roll, a pillow, a foam roller, whatever you have at home. Put this down on the floor, and then we're just going to do a heel prop, working into extension. We're going to let gravity help pull that leg down. So beginners, if you're pretty stiff and you're lacking some knee extension, starting just flat on the floor or the table or wherever you are might be a good starting point. As you start to improve your knee extension range of motion, prop your foot up, get a little space below the table or the floor in your leg, and then let gravity help pull the knee down. So I'm not getting much of a stretch with this little pillow. I'm going to use this foam roller. We're going to get that leg elevated a little bit more and let gravity, again, work and push that knee straight. So this position, you're going to start off with 2 to 3 minute holds, work your way up to 5 to 10 minutes. I also encourage people while they're doing this, or you can do it after as well. It just might give you a little more time, I guess, to deal with. So I also incorporate ankle pumps, pulling the toes up, stretching that calf muscle. The calf muscle does cross both the ankle and the knee joint on the back side of the leg. So if your calf gets tight, that can limit full knee extension. So just getting some ankle movement, try to loosen up the calf muscle. That'll help get your knee extension back. So this, if I'm doing just ankle pumps, I would do several 20 to 30 repetitions. If I'm doing just the heel prop, trying to let gravity help, I would hold I would shoot for 5 to 10 minutes. If you wanted to get a little more bang for your buck, you could push down on your thigh. You could also get a small weight, an ankle weight or a pillow, and just set that kind of right above the knee joint on your femur, and then let the additional weight help pull the knee down. So if you're doing the weight on top of the leg, go back to 2 to 3 minutes with the weight, and then once that becomes comfortable for the 2 to 3 minutes, then increase back up to 5 or 10. Okay, so that's perfect. Good work with that one. The next one we're going to do is a quad set. So we're going to use that towel roll or that small pillow, and we're going to put that underneath your knee, just below the crease of the knee, kind of back to that starting position of the heel slide. And then all you're going to do is just try to smash that pillow. So I'm using my quadricep to push my knee down into that pillow. Hold for 2 to 3 seconds, repeat 10 to 12 repetitions. Push, hold, good. In order to maximize the contraction of the quadricep muscle or your thigh muscle, pull your toes up towards your nose. Pull the toes up, push that quadricep down, push the knee down, tighten your quadricep, hold for 2 to 3 seconds, and then relax. So with this quad set, I want you to try to really push as hard as you can, like 100%. Now, that being said, if it's painful, do what's tolerable. Don't try not to push into pain. Just start slow, work your way up, try to shoot for 100%. So again, 10 to 12 repetitions. After this quad set, we're going to go to a straight leg raise. So we're going to start here with the left leg straight, right knee bent up to take pressure off your back. Pull the toes up to engage that quad. Do your quad set. Try to lift the leg up towards the ceiling and then back down. Again, back up. And here I would shoot for 8 to 10 repetitions. This is a little more difficult to do, so we'll do just a fewer less repetitions. And if you're having troubles activating your quadricep muscle, or you don't feel like your strength is adequate to lift the leg up, you're probably going to show some knee flexion with the leg raise. If that's the case, get yourself a belt or a towel or a resistance band, put it underneath the foot, cross it once, and then we'll turn this into an active assisted exercise to where your arms can help you raise the leg, keep the leg straight, and then you'll kind of let go with your hands and slowly lower. If you're still having that knee bend as you let go, then just go ahead and help the leg, lower the leg down to the floor. So use the band if you need to. Your muscles are going to get stronger, you will adapt, and then you can get away from the band as the strength progresses. So again, 8 to 10 repetitions with this one. Straight leg raise is what this is called. Kind of working the hip flexor, working the quadricep muscle. You're starting to get a little stretch down the back side of the leg. Perfect. Do one more without the band. Good. If you wanted to progress down the road, you could put an ankle weight on your leg somewhere. The closer the weight is to the hip, the easier it's going to be. So if you're going to add a 1 pound weight, I would put it maybe on the thigh to start with. If that's easy for 10 repetitions, move the weight kind of down the leg as you progress. So as a general rule of thumb, weight progression, I would advise you to go in 1 pound increments. So go to a 1 pound ankle weight. If you can do 3 to 4 sets of 10 repetitions easy, you just hammer it out and that ankle weight's all the way to your ankle, then you might bump up 1 pound. So that's kind of my general rule of thumb, 1 pound increments when you're using weight. So perfect. We'll go on to the next one. It is going to be with the foam roller or a bolster of some sort. You could use a coffee can, a 2-liter pop bottle. You could stack some pillows up, whatever it may be, just to get something underneath your leg to get a little knee bend. So this one is just it's a quadricep exercise. We call it a short arc quad. We're gonna just lift the foot up, leaving the knee and leg on the bolster. So there's gonna be that pivot point there to where you activate your quad, it pulls on your shin and straightens your leg. So again, similar to the quad sets and the straight leg raise, by pulling the toes up, you're gonna maximize the work of that quadricep muscle. So this one here, I would shoot for 10 to 12 repetitions again. Again, starting with the weight of the foot. If it's too difficult, you could do an assisted short arc quad with the rope or towel around the foot, and then you would progress to the weight of the foot. You could add your ankle weight again in 1 pound increments. Just again, whatever you can tolerate will be beneficial. And as you go, it's going to get easier. So that was a short arc quad. The next one we're going to do, we're going to flip around here. So I almost always give hip strengthening exercises to mostly everybody with a lower extremity injury or post-op status or whatever it may be. So we're gonna go right sideline for the left leg. Try to get nice and comfortable. We're gonna keep your feet, hips, shoulders all in a straight line. There's a wall behind me. I can imagine like I'm laying up against that wall with my feet, butt, back, all up against that wall. So this clamshell, I'm keeping everything still, keeping a nice tight core, a neutral spine, keeping everything in line as I open that knee, just like a clamshell. So lift the knee towards the ceiling, hold for just a second, back down. This is gonna target that lateral hip muscle. And with this one, I shoot for 15 to 20 repetitions, trying to work more endurance. So we'll keep going here. We're gonna hammer out 15. Make sure you are not compensating by rolling your shoulders and chest up towards the ceiling. Then you're cheating. You're not gonna get that strength benefit here. So try to keep everything still. Isolate that movement to the hip. And you will get a pretty good burn off with this exercise. So 3 to 4 sets, 15 to 20 repetitions. And again, this is called the clamshell. Okay, next one is a progression from the clamshell. It's a straight leg raise, but in side lying, so a side lying hip abduction. I'm gonna have you still imagine like you're laying against the wall. Keep your hip, foot, and ankle, your leg, and your back all in a straight line, just like you're up against the wall. Keep your toes pointed forwards. Make sure your toes don't point up towards the ceiling. That would be a compensation. So what we're gonna do is just lift the leg up and then lower it back down. Just like you're trying to slide that heel up and down the wall. And this one's, again, like the straight leg raise, generally a more difficult exercise. So I would do more closer to 10 to 12 repetitions, just so you don't start to compensate when you get up to the closer to the 15 range. So 10 to 12 repetitions with this. Again, you're gonna feel that on that posterior lateral hip. You might feel a little bit down the leg, that's okay. Just focus on keeping your toes straight. Use a pillow to support the head and neck. And you're doing good. Okay, perfect. After that one, you can roll over to your stomach. We're going to do another quadricep exercise with the toes pulled up onto the table. We're gonna lift the knee up towards the ceiling. So pushing through my toes, tighten the quadriceps, hold for 2 seconds at the top, and then slowly lower it back to the table. So again, similar to the quadriceps sets that we first started with smashing the towel under our knee, I want you to really try to focus on a maximal contraction with this this knee extension here. Squeeze, hold, 2 seconds, good. Again, listen to your body if it's painful. Don't squeeze as hard. Maybe This one is a progression from the original quad set where we were laying on our back. So if this is too difficult, go back to the easier one where you're laying on your back, pushing the knee down to the table. So go back to this one, stick with this one for 2 or 3 days, come back to the one laying on your stomach and see if it's any easier. So with this one, once you can do it easy, I would do 15 to 20 repetitions, 2 or 3 sets. And that is perfect. Okay, next one, we're gonna be sitting on the side of the table, sitting in a chair, sitting on your countertop, on your kitchen table, if your wife or your mom or whoever it is will allow you to do that. And then all we're gonna do is sit up nice and tall. If you have a back support, that would be wise, just so you don't hunch over and round your back or compensate. We're just gonna do a knee extension using the quadricep to straighten the leg. Again, similar to every other exercise, if you want to pull the toes up to help maximize that contraction, that should help. With this one, you could add an ankle weight, again in 1 pound increments. Hold it at the top, let it down slowly. Let it down slow. Perfect. Good. Okay, so sitting in this position kind of just reminded me of another knee flexion stretch. So if you've just had surgery or if you have a stiff knee, whatever it may be, again, consult with your orthopedic physician. But if you're trying to improve knee flexion, you can do it in a seated position. Starting out, if you're limited on knee bending and you're not able to get it down to a 90-degree angle, hook your other foot underneath and then let gravity help lower your leg for you. So the right leg, the opposite leg, is just kind of there for a little security blanket, if you will. You could try to kind of push the left heel down into your right leg. That might reduce some of that discomfort. I would push down for maybe 2 or 3 seconds and then relax and see if gravity can help lower you a little bit further. Once you get to the point to where you can totally relax that leg, let gravity pull it down, then from there you could put the leg on the front side to help push it back. Again, just as tolerated. I would do several repetitions similar to the heel side when we were laying on our back. Push it back, get it to a certain point where it's tight, hold for 2 or 3 seconds, and then relax it out and repeat that. So guys, I hope you enjoyed that information. Those exercises, again, are very easy. Pick 2 to 3, hammer them out, focus on them. Add ankle weights if you need to, again in 1 pound increments. If some of those exercises were a little too challenging, use a belt, use a towel, a resistance band for a little assistance. Kind of go back to the basics, go back to the easy stuff, get good at those easy exercises, and then progress from there. So again, always consult with your orthopedic physician or a physical therapist to be sure that you're following protocol, not doing something that will compromise the surgical procedure. Otherwise, give those a try. Let me know in the description or the comment below if you have any other further questions. I will provide some information in the description below this video. Refer to that information at your convenience. I hope it answers your questions. And then we'll see you back here for our next video. Be sure to subscribe to the YouTube channel, High Caliber Health. Hit the little bell so you don't miss our next video. Also follow us on Facebook, High Caliber Health. It's a private Facebook group where we discuss all things hunting, all things fitness, injury prevention. I am on there quite a bit, so if you have a question that you want to get answered fairly quickly, check us out on Facebook. So again, good job with all those exercises. I hope you enjoyed it. I hope you learned something, and we'll see you back here next time. As always, get some movement. Take care. Have a good day.